Now, our next speaker is Chris Keys from MHCC. Chris will be talking to us about the Cert 4 in mental health peer work that's been alluded to a few times. Chris is currently managing the Learning and Development component of the Mental Health Coordinating Council and was project manager of the Mental Health Peer Work Qualification Development Project. She's a regional manager capacity, and she has experience of working within a community organisation at a time of great growth of their peer workforce, and contributed to introducing peer work positions across a range of programs. Proudest moment was 2 weeks ago being able to share the news of the release of the Cert 4 peer work resources by the National Mental Health Commission, and I'm sure that Janet Ma would back you on that proud moment. Thank you, Chris.
Thank you. The great thing about that moment was that we were in the midst of a 5-day workshop with the first national champions for peer work, and in the midst of assessment activities, I was so thrilled to stand up and say, guys, we have some really exciting news, and many people in the room have been involved for a number of years in relation to seeing this qualification finally come to life. So it was a highly emotional and very exciting moment, which I don't think I'll ever forget. So I don't think I can stand here and talk about the Cert 4 in peer work without acknowledging the long history and the contribution of many people, some who are in the room today, who worked long and hard towards seeing this happen. The Community Services and Health Industry Skills Council in 2010 funded the Mental Health Peer Workforce Competency Development Project to understand the role of the peer workforce and develop competencies which would form the qualification. And they did that with a large national reference group. Pivotal in that process was a forum in 2011 by the National Mental Health Consumer Carer Forum, called the Mental Health Consumer and Carer Identified Workforce, in which Larry Frick spoke. And that was a pivotal day in terms of exploring the peer work competencies and how we could possibly develop this workforce. Then, of course, in 2012, the National Skills Standards Council endorsed and released the Cert 4 in mental health peer work qualification. For a little while following that, there was a limit to how much the training was filtering out and being available for peer workers, and that's because registered training organisations, once a qualification is released, have a lot of resource development to undertake to develop a suite of resources that enable you to be in a room with students and train the qualifications. So we're very thankful that the National Mental Health Commission recognised this barrier for registered training organisations and funded the Mental Health Peer Work Qualification Development Project, which MHCC were fortunate to coordinate on behalf of Community Mental Health Australia. And this work was about developing a national consistent set of learner and trainer resources for the Cert 4. The qualification itself includes 2 streams, one for consumer peer workers and for carer peer workers, and I'll talk to that a little bit as we go on. But it also acknowledged and funded a peer leadership skill set for peer workers that are aspiring or currently working in leadership or mentoring roles. And in a few months' time, the National Commission will also be releasing the accredited skill set resources so that this training is also able to be available. I can't speak highly enough to the process that enabled the Cert 4 resources to come to life. It was a highly productive and successful process, and I felt very privileged to experience that. We had 25 people from every state and territory, experienced consumer and carer peer workers and representatives from organisations with experience in supporting a peer workforce, and they represented public, private and community managed services. An absolute thrill to have an opportunity to work with that group. If peer support is understood as a reciprocal exchange, as Sherry Mead says, based on respect, value of lived experience, shared responsibility and mutual agreement, then it's these core values that really drew together the diversity of experiences we had in this group that represented Australian peer work experience. And this was allowed to be distilled into the suite of high quality resources that we now have available for this qualification as of 2 weeks ago. And here's a quote that was shared by one of our reference group members. Okay, moving right along, not much time here. The training, the Cert 4 training is catered specifically to consumer or carers working in designated peer work roles across service settings. The qualification speaks to that one-on-one direct support, that peer support element of a peer role. Just to give a flavour for people, but I do encourage you, as Faye and Leanne mentioned earlier, to go to the National Commission's website and take a look. The first part of the qualification, it is 15 days in total. The first 8 days are dedicated to what we've termed foundations of peer work. It covers a whole host of topics, as you can see, helping people to understand the history and philosophy, about sharing one's lived experience in that role, how to navigate the mental health service system as an individual, and then how to support another person to do that. Peer work in the workplace, what makes an effective worker, how to work as part of a team, understanding conflict, the importance of supervision and mentoring. The second part of the qualification looks to how one supports self-advocacy, how to work effectively in trauma-informed care, building relationships based on those principles, working effectively with carers, understanding the impact of caring, supporting self-directed physical health and wellbeing, looking at what wellbeing means, the various components of that, and international programs that have been successful in that space, and then some of the generic units that form the qualification as well. The majority of the qualification contains peer work specific units, and the national training package requires that they be provided by people with lived experience of mental illness, either as a consumer or carer. In a couple of months in June, the Skills Council will also be announcing some changes which also require trainers to have experience in peer work itself, which I think is really important, and certainly MHCC have peer work Cert 4 trainer workforce with peer work experience as well. The trainers have to be qualified, which means have a Certificate 4 in Training and Assessment to deliver a qualification. They'll also have the Cert 4 in peer work themselves. We use a co-trainer model, so we have a trainer who, two trainers, one who trains from consumer peer work perspective and the other from carer peer work perspective. We think that's really important, and our trainers represent services in the community managed and public service settings. Just if I can talk really quickly about the pilot project, I know it was mentioned before, as part of the funding to develop the resources, we were able to pilot that. We started the pilot back in September last year, and 14 participants were able to take advantage of that, that project. It's been a really valuable experience for confirming the relevance of the training for peers across a range of roles. It also taught us important things around how to deliver the training. How many days in a row is it really worth running a training block around how should we best structure the assessment so there's not too much due at once and people can manage that within their existing roles and other commitments. We've got 2 more days of the pilot to train, and that will be taking place in May, and then we'll have 14 participants that have undertaken that, sorry, 13. We started with 14 and we've got 13 people still in the pilot, and we're incredibly happy about that result. Student support has been really important, and we've learnt a lot through the pilot project around that. It's important to understand people's past experience of training and study and how that plays out in terms of how you feel about approaching assessments. We've employed a range of assessment support strategies, such as we hold assessment workshops for people to work with the trainer and ask questions in different ways. Looking at study skills and how to break a question up in order to respond. The relationship with the workplace has been really important too. That enables us to look at what structures are going to be helpful in the workplace. Perhaps it's spending time with an experienced worker or a mentor, having time in the workplace that can be dedicated to focusing on learning and completing assessments. It's been really critical to the process. Not much time for quotes, but there you are. There's a few different options for training. The face-to-face option is 14 face-to-face days, and we deliver an online component in work health and safety. We also have recognition options. Some people like an evidence portfolio approach, which we can certainly accommodate, but we've had the recent experience of the Champions project where we ran a 5-day assessment workshop that incorporated a range of different activities, large group, smaller group discussions, role plays, different activities where people could demonstrate their competency in an interactive, supportive environment, and we'll be looking to make that available. We're also in an exciting time. The Smart and Skills project that's operating in New South Wales as part of the VET reform process has made some really attractive incentives available to help people to access the certificate for. Can people hear me? Yep. So this includes traineeships. No, shouldn't have touched it. There's traineeship options available, which makes the training more affordable, but also provides incentives to the organisation itself. There's also fee exemptions and reductions depending on people's situation, and I'd love to talk to people later about the fine details of those. We're also committed to providing the training not just in metro but in regional areas across the state as well, and we're working currently to understand where there are areas of more demand so that we can get the training out to those areas. What I haven't talked about is that though the qualification is different for consumers and carers slightly, the National Reference Group developing the materials felt that it was really critical that all components of the training were written in a way that both consumer and carers could experience and train in. So the resources have been written in that way, and we're certainly aiming to train both carer and consumer workers in the training room together, believing that this leads to new ways of thinking. It increases the understanding of each other's role. There's opportunities to find ways to work more collaboratively together in the workplace also. And just to finish on a nice warm fuzzy, this is our Sydney group of champions last week. So the champions is in acknowledgement that there are a few people nationally who hold the Cert 4 in peer work, as well as a training and assessment qualification, who are able to deliver the Cert 4 in peer work nationally. So we have 30 champions across every state and territory who will be undertaking the 5-day recognition process to gain the qualification, and then most importantly to be champions in their local area and to work with registered training organisations to see that the Cert 4 gets out there to peer workers. Thank you.